Hello everyone, and welcome back to our series on men's health. In our previous video, we explored what erectile dysfunction is and why it matters. In this video, we'll dive deep into the causes of erectile dysfunction. If you're experiencing this issue or simply want to learn more to prevent it, stick around until the end and don't forget to hit like and subscribe to stay updated with our next episode. Erectile dysfunction, ED, is defined as the persistent difficulty in achieving or maintaining an erection sufficient for satisfactory sexual intercourse. It's a common condition, affecting approximately 30 million men in the United States. According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, symptoms and causes of erectile dysfunction. In this segment, we'll examine the primary physical causes of ED, including cardiovascular disease, diabetes, hormonal imbalances, neurological disorders, medication side effects, and other factors such as obesity. All information presented is grounded in scientific research from reputable sources such as the Journal of the American College of Cardiology, Diabetes Care, and Mayo Clinic. Part 1. Physical causes. 1. Cardiovascular disease. Cardiovascular diseases, such as atherosclerosis or coronary artery disease, are among the leading causes of ED. According to a study published in the Journal of the American College of Cardiology, ED is a strong predictor of coronary artery disease, with men experiencing ED having a 50% higher risk of heart disease compared to those without the condition, erectile dysfunction, and coronary artery disease. Mechanism: atherosclerosis causes narrowing or blockage of blood vessels, reducing blood flow to the penis, which is critical for achieving an erection. Additionally, endothelial dysfunction impairs the production of nitric oxide, a key chemical that facilitates blood vessel dilation. Evidence: a study in the International Journal of Impotence Research found that men with ED have a higher prevalence of cardiovascular risk factors, such as hypertension and elevated cholesterol, erectile dysfunction as a predictor. Thus, prioritizing cardiovascular health not only protects your heart, but also helps maintain your sexual performance. 2. Diabetes. Diabetes significantly increases the risk of ED. According to Diabetes Care, the prevalence of ED in men with diabetes ranges from 35% to 75%, depending on age and glycemic control. Erectile dysfunction in diabetes. A study in the Journal of Sexual Medicine further confirms that diabetes increases the risk of ED threefold compared to men without diabetes, and erectile dysfunction. Mechanism: diabetes causes damage to both blood vessels and nerves. Elevated blood glucose levels lead to the formation of advanced glycation end products, AGEs, which impair endothelial function and obstruct blood flow. Concurrently, diabetic neuropathy disrupts nerve signals from the brain to the penis. Solution: tight glycemic control through diet. Exercise and medication can reduce the risk or improve ED in men with diabetes. 3. Hormonal imbalances. Hormones, particularly testosterone, play a critical role in erectile function. According to the Journal of Clinical Endocrinology and Metabolism, testosterone deficiency, also known as hypogonadism, is associated with ED in 10% to 20% of affected men. Testosterone and erectile function. Mechanism: low testosterone levels reduce sexual desire and impair the production of nitric oxide, hindering blood vessel dilation in the penis. Evidence: a study in the Asian Journal of Andrology found that testosterone replacement therapy can improve erectile function in men with hypogonadism. Testosterone and erectile function. If you suspect a hormonal issue, a blood test ordered by your doctor is the essential first step. 4. Neurological disorders. Neurological conditions such as Parkinson's disease, multiple sclerosis, or spinal cord injuries can contribute to ED. A study in the Journal of Neurology, Neurosurgery and Psychiatry indicates that ED is prevalent among men with Parkinson's disease, erectile dysfunction in Parkinson's disease, while the Multiple Sclerosis Journal reports ED as a common symptom in multiple sclerosis, sexual dysfunction in multiple sclerosis. Mechanism: nerves responsible for erections transmit signals from the brain to the penis. Neurological disorders disrupt these signals, severely impairing erectile function. Example: in men with spinal cord injuries, the extent of nerve damage determines the ability to maintain an erection. 5. Medication side effects. Certain medications can cause ED as a side effect. According to Mayo Clinic, commonly implicated drugs include antidepressants, SSRIs, antihypertensive drugs, beta blockers, antihistamines. Evidence: approximately 25% of ED cases are linked to medication side effects. Per Mayo Clinic statistics, medications that can cause erectile dysfunction. If you suspect your medication is affecting your erectile function, consult your doctor to explore alternative treatments or adjustments. 6. Obesity and metabolic syndrome. Obesity and metabolic syndrome, characterized by hypertension, insulin resistance, and dyslipidemia, are significant risk factors for ED. A study in the Journal of Sexual Medicine found that obese men have a significantly higher prevalence of ED, obesity and erectile dysfunction. Similarly, the International Journal of Obesity confirms that metabolic syndrome increases the risk of ED, obesity, and sexual dysfunction. Mechanism: obesity induces chronic inflammation and endocrine dysfunction, reducing blood flow and testosterone levels. Solution: weight loss, regular exercise, and a healthy diet can significantly improve erectile function, as supported by research. Conclusion: physical causes such as cardiovascular disease, diabetes, hormonal imbalances, neurological disorders, medication side effects, and obesity all contribute to ED. Importantly, many of these factors are preventable or treatable through lifestyle changes and medical interventions. Consult a healthcare provider to identify specific causes and develop a tailored treatment plan. Part 2. Psychological causes of erectile dysfunction. Erectile dysfunction, ED, is not solely driven by physical issues. Psychological factors also play a significant role. According to Cleveland Clinic, approximately 10 to 20% of ED cases are purely psychological, and in many instances, psychological factors exacerbate physical causes. Psychological causes of erectile dysfunction. In this section, we'll explore 4 primary psychological causes of ED: stress, depression, performance anxiety, and relationship issues. Each cause will be analyzed in terms of its mechanisms, supported by scientific evidence from sources like the Journal of Sexual Medicine, Psychological Medicine, and Mayo Clinic, along with practical solutions. 1. Stress. How does stress affect ED? Stress, particularly chronic stress, is one of the most common psychological causes of ED. When the body is under stress, the sympathetic nervous system is activated, leading to vasoconstriction and reduced blood flow to the penis, a critical factor for achieving and maintaining an erection. Stress also elevates cortisol levels, a hormone that suppresses testosterone production, directly impacting libido and sexual function. Scientific evidence. A study in the Journal of Sexual Medicine found that men with high stress levels have a 39% increased risk of ED compared to those with lower stress. Stress and erectile dysfunction. Research in psychoneuroendocrinology indicates that elevated cortisol due to stress reduces blood flow to the genital organs, impairing the erection process. Cortisol and sexual function. Solutions. To mitigate the impact of stress. Techniques such as meditation, yoga, or regular exercise can help regulate the nervous system and lower cortisol levels. Consulting a mental health professional to develop effective stress management strategies is also a valuable option. 2. Depression. How are depression and ED related? Depression affects not only mood but also sexual function. Individuals with depression often lose interest in activities, including sexual intercourse, leading to reduced libido and difficulty achieving an erection. Additionally, certain antidepressants, such as SSRIs, selective serotonin reuptake inhibitors, may cause ED as a side effect. Biological mechanism. Depression reduces levels of serotonin and dopamine, neurotransmitters critical for sexual desire and arousal. This disrupts neural signaling from the brain to the penis, impairing the erection process. Scientific evidence. A study in the Journal of Affective Disorders found that approximately 25% of men with depression experience sexual dysfunction, with ED being a prevalent symptom. Depression and sexual dysfunction. Research in psychological medicine confirms that men with depression have a twofold higher risk of ED compared to those without depression, and erectile dysfunction. Solutions. Treating depression with psychotherapy, cognitive behavioral therapy, or CBT, combined with medications adjusted to minimize sexual side effects, and lifestyle changes can improve both mood and erectile function. 3. Performance anxiety, the vicious cycle of anxiety. Performance anxiety occurs when men worry about their ability to perform sexually. According to Mayo Clinic, this anxiety can create a vicious cycle. Anxiety leads to erectile failure, which in turn heightens anxiety. Worsening ED, erectile dysfunction, symptoms and causes. Mechanism of impact. Anxiety triggers the fight or flight response, increasing adrenaline levels and causing vasoconstriction, which restricts blood flow to the penis. Additionally, a preoccupied mind reduces the ability to focus and relax, two essential factors for achieving an erection. Scientific evidence. A study in the Journal of Sexual Medicine indicates that approximately 20% of men under 40 with ED attribute it to performance anxiety, psychogenic erectile dysfunction. Research in the International Journal of Impotence Research shows that cognitive behavioral therapy, CBT, significantly improves ED in men with performance anxiety, CBT for erectile dysfunction. Solutions employing CBT to address negative thought patterns. Practicing relaxation techniques, deep breathing, and fostering open communication with a partner can break this cycle and enhance sexual function. 4. Relationship issues. Relationship dynamics and ED relationship problems, such as conflicts, lack of communication, or emotional disconnection, can contribute to ED. When a relationship is strained, men may feel pressured or lose sexual desire, leading to difficulties maintaining an erection. Mechanism of impact. Conflicts generate stress and anxiety, affecting the nervous system and hormonal balance. A lack of intimacy or misunderstandings about sexual needs can also reduce arousal and desire. Scientific evidence. A study in the Journal of Sexual Medicine identifies marital issues as a strong predictor of ED, relationship issues, and erectile dysfunction. Research in the Archives of Sexual Behavior found that men in unhappy relationships have a significantly higher prevalence of ED, relationship satisfaction, and sexual function. A study in the Journal of Sex and Marital Therapy demonstrates that couples therapy improves both relationship quality and sexual function. Couples therapy for erectile dysfunction. Solutions: improving communication, engaging in couples therapy, and dedicating time to rebuild emotional connection can resolve these issues and restore erectile function. Conclusion: stress, depression, performance anxiety, and relationship issues are key psychological causes of erectile dysfunction. These factors not only affect the mind, but also directly influence biological mechanisms, including hormones, neural signaling, and blood flow. Treating ED requires more than medication. Addressing the psychological roots through therapy, stress management, and improved relationships is crucial. If you're experiencing ED, consider seeking support from a psychologist or physician for a tailored approach. Part 3. Unhealthy lifestyle factors causing erectile dysfunction. Unhealthy lifestyle choices are a major contributor to erectile dysfunction, ED, affecting millions of men worldwide. According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, habits such as smoking, obesity, excessive alcohol consumption, and physical inactivity not only increase the risk of ED, but also exacerbate other health issues, symptoms, and causes of erectile dysfunction. In this section, we'll analyze 4 key lifestyle factors: smoking, obesity, excessive alcohol use, and physical inactivity, discussing their mechanisms, supporting scientific evidence, and practical solutions for improvement. 1. Smoking. How does smoking affect ED? Smoking is a significant risk factor for ED due to its damaging effects on blood vessels and reduced blood flow to the penis, which is essential for achieving an erection. Nicotine and other chemicals in tobacco cause vasoconstriction and impair the production of nitric oxide, a critical chemical for blood vessel dilation and erection. Scientific evidence. A study in the American Journal of Epidemiology found that smokers have a 1.5 to 2 times higher risk of ED compared to non-smokers, with the risk increasing with the number of cigarettes smoked daily, smoking, and erectile dysfunction. According to the Journal of Sexual Medicine, quitting smoking can improve erectile function within 6 to 12 months in long-term smokers, smoking cessation, and erectile function. Solutions. Quitting smoking is the critical first step. Smoking cessation programs, including nicotine replacement therapy or behavioral counseling, can help break the habit. Additionally, improving cardiovascular health through diet and exercise supports the recovery of erectile function. 2. Obesity. How are obesity and ED related? Obesity increases the risk of ED through multiple mechanisms, including vascular damage, hormonal imbalances, and chronic inflammation. According to Mayo Clinic, obese men have a significantly higher risk of ED compared to those with a healthy weight. Erectile dysfunction, symptoms and causes. Obesity is often associated with metabolic syndrome, which includes hypertension, insulin resistance, and dyslipidemia, all contributing to ED. Biological mechanism: vascular damage. Excess adipose tissue causes chronic inflammation, damaging the vascular endothelium and reducing blood flow to the penis. Hormonal imbalance. Obesity lowers testosterone levels by increasing the conversion of testosterone to estrogen in fat tissue. Metabolic syndrome. Hypertension and insulin resistance impair vascular function, directly affecting erectile capacity. Scientific evidence. A study in the Journal of Sexual Medicine found that men with a body mass index, BMI, above 30 have a 30% higher risk of ED compared to those with a normal BMI, obesity, and erectile dysfunction. Research in the International Journal of Obesity confirms that weight loss through diet and exercise can improve erectile function in obese men, obesity, and sexual dysfunction. Solutions: weight loss through a healthy diet, rich in vegetables, fruits, and lean protein, and regular exercise, at least 150 minutes per week, can significantly enhance erectile function. Consulting a nutritionist or physician to develop a safe and effective weight loss plan is recommended. 3. Excessive alcohol consumption. Impact of alcohol on ED chronic. Excessive alcohol consumption is a significant risk factor for ED. While small amounts of alcohol may reduce inhibition, excessive or frequent drinking can damage nerves, lower testosterone, and impair vascular function. Biological mechanism. Nerve damage. Alcohol causes damage to the central and peripheral nervous systems, disrupting signals from the brain to the penis. Testosterone reduction. Excessive alcohol suppresses testosterone production, affecting libido and erectile capacity. Vascular damage. Alcohol induces inflammation and endothelial damage, reducing blood flow necessary for erections. Scientific evidence. A study in the Journal of Sexual Medicine found that men who abuse alcohol have a 1.7 times higher risk of ED compared to moderate drinkers. Alcohol and erectile dysfunction. According to Australian prescriber, chronic alcohol abuse increases the prevalence of ED and other sexual dysfunctions. Drug-induced sexual dysfunction. Solutions limiting alcohol intake to moderate levels, no more than 2 standard drinks per day for men, or abstaining entirely is recommended. Participation in alcohol cessation programs, such as Alcoholics Anonymous, or consulting a physician can support improvements in overall health and sexual function. 4. Physical inactivity. Physical inactivity and ED. A sedentary lifestyle increases the risk of ED by negatively affecting cardiovascular health, hormone levels, and blood flow. According to the American Journal of Public Health, physically inactive men have a 40% higher risk of ED compared to those who exercise regularly. Physical activity and erectile dysfunction. Biological mechanism. Cardiovascular health. Inactivity contributes to hypertension, high cholesterol, and atherosclerosis, all of which reduce blood flow to the penis. Hormone levels. Exercise boosts testosterone production and improves mood, while inactivity suppresses these benefits. Chronic inflammation. A sedentary lifestyle increases systemic inflammation, damaging blood vessels and impairing erectile function. Scientific evidence. A study in the Journal of Sexual Medicine shows that moderate intensity exercise, brisk walking or jogging for 30 minutes per day, 5 days a week, can reduce the risk of ED in middle-aged men, exercise and erectile function. Research in the British Journal of Sports Medicine indicates that men who exercise regularly have significantly better erectile function compared to sedentary peers, physical activity, and sexual health. Solutions start with simple exercises like brisk walking, jogging, or weight training for at least 150 minutes per week. Cardiovascular exercises, such as cardio or HIIT, are particularly effective in improving blood flow and erectile function. Conclusion. Unhealthy lifestyle factors, including smoking, obesity, excessive alcohol consumption, and physical inactivity, are major contributors to erectile dysfunction. The good news is that these habits are modifiable, offering opportunities to improve both sexual health and overall well-being. Quitting smoking, losing weight, moderating alcohol intake, and staying active can significantly reduce the risk of ED. If you need support, consult a healthcare provider or specialist to create a personalized plan. Part 4. Impact of aging on erectile dysfunction. Aging is an inevitable factor that significantly affects erectile function. According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, erectile dysfunction, ED, becomes more prevalent as men age, affecting approximately 30 million men in the United States, particularly in middle and older age groups. Symptoms and causes of erectile dysfunction. In this section, we'll analyze how aging impacts ED through biological changes, prevalence statistics, and solutions to maintain sexual health. All information is supported by research from the Journal of Sexual Medicine, New England Journal of Medicine, and Mayo Clinic. 1. Biological changes. Due to aging testosterone decline. As men age, levels of testosterone, a critical hormone for libido and erectile function, gradually decline. According to the Journal of Clinical Endocrinology and Metabolism, testosterone decreases by approximately 1 to 2% per year after age 30. Testosterone decline with aging. This reduction not only diminishes sexual desire, but also affects nitric oxide production, essential for blood vessel dilation and erections. Mechanism. Low testosterone reduces neural signaling from the brain to the penis and impairs vascular dilation. Additionally, testosterone influences mood and energy, indirectly affecting sexual health. Vascular dysfunction. Aging reduces blood vessel elasticity, a condition known as atherosclerosis. According to the New England Journal of Medicine, this limits blood flow to the penis, making it difficult to achieve or maintain an erection. Vascular causes of erectile dysfunction. Reduced vascular flexibility also diminishes the efficacy of nitric oxide in the erection process. Mechanism. Blood vessels become sclerotic or obstructed by plaque buildup, reducing the blood volume necessary for sustained erections. Neurological damage. The nervous system is also affected by aging, leading to reduced sensitivity of neural signals from the brain to the penis. According to the Journal of Sexual Medicine, age-related neurological changes, such as reduced neuron count or peripheral nerve damage, disrupt the erectile process, neurogenic erectile dysfunction. Mechanism. Weakened neural signals impair the activation of the erectile mechanism, particularly in individuals with underlying conditions like diabetes or cardiovascular disease. 2. Prevalence of ED by age research data. ED becomes more common with advancing age. The Massachusetts Male Aging Study, MMAS, a landmark study on men's health, found approximately 52% of men aged 40 to 70 experience some degree of ED, ranging from mild to severe. Prevalence of erectile dysfunction. The prevalence increases significantly with age, about 40% in men aged 40, 50% in men aged 50, and up to 70% in men aged 70. A study in the Journal of Sexual Medicine confirms that age is an independent risk factor for ED, even in the absence of comorbidities, age and erectile dysfunction. Contributing factors. Aging is often accompanied by chronic conditions such as diabetes, hypertension, and cardiovascular disease, which amplify the risk of ED. According to Mayo Clinic, older men are more likely to have these comorbidities, exacerbating ED, erectile dysfunction, symptoms and causes. 3. Other age-related factors, medication and chronic conditions. Older men often take multiple medications for chronic conditions, such as antihypertensives or antidepressants, which can cause ED as a side effect. According to Cleveland Clinic, about 25% of ED cases in older men are linked to medications and erectile dysfunction. Psychological changes. Aging may also bring psychological changes, such as stress or depression due to job loss, retirement, or health concerns. As discussed in Part 2, these factors increase the risk of ED. 4. Solutions to mitigate the impact of aging lifestyle changes. Maintaining a healthy lifestyle can slow the age-related decline in erectile function. According to the British Journal of Sports Medicine, older men who exercise regularly, brisk walking or cardio for 150 minutes per week, have significantly better erectile function, physical activity, and sexual health. Diet. A diet rich in vegetables, fruits, and healthy fats, Mediterranean diet, improves cardiovascular health and blood flow. Exercise. Activities like cardio, weight training, or yoga boost testosterone and enhance circulation. Adequate sleep. Quality sleep regulates hormones and reduces stress. Medical interventions testosterone therapy. According to the Journal of Clinical Endocrinology and Metabolism, testosterone replacement therapy can improve erectile function in older men with testosterone deficiency, testosterone therapy, and erectile function. However, consultation with a physician is necessary to weigh benefits and risks. Erectile dysfunction medications. Drugs like sildenafil, Viagra, or tadalafil, Cialis, enhance blood flow to the penis. Effective in older men, PDE5 inhibitors. Regular checkups. Early detection and management of conditions like diabetes or hypertension can reduce ED risk. Psychological support. If ED in older men is linked to anxiety or depression. Cognitive behavioral therapy, CBT, or counseling can improve mood and restore confidence, CBT for erectile dysfunction. Conclusion. Aging increases the risk of erectile dysfunction through declining testosterone, vascular dysfunction, and neurological damage. However, ED is not an inevitable part of aging. Lifestyle changes, medical interventions, and psychological support can help men maintain sexual health at any age. If you're experiencing issues, consult a healthcare provider to identify specific causes and develop a tailored plan. Erectile dysfunction can stem from various causes, but the key takeaway is that you don't have to face it alone. In our next episode, we'll explore when you should see a doctor and the first steps to address this issue. Don't miss out. Hit the notification bell to get updated as soon as the video drops. If you found this video helpful, please share it with friends and leave a comment about topics you'd like us to cover next. Thank you for watching. Stay tuned to our channel for more insights on men's health. See you in the next video.